Hello, I'm going to present a presentation here on how our learning and working environments can impact upon our mental health. I think it's something that we can all focus on in our own lives. We can make small changes to our working and learning environments, and these changes will not only help us to be more productive, but they'll also have an impact on our mental health. So I'm hoping that you'll find something useful during this presentation. To start off with, I'd just like to present a little bit of a challenge, a thinking exercise, and just look at these photos and see if you can guess what building or what type of building this is. So I'll give you a few seconds to do that. Perhaps this will be more obvious. You can see the people wearing white coats to the left there. It is a mental health hospital. It's at the El Camino Hospital in Silicon Valley, and I just thought I'd mention this because when we think about mental health hospitals, we generally don't think about places which are welcoming. We think of, or at least I think of, places which are quite drab, dreary, depressing, all of that. And I think it's important to think about how lighting and greenery and the use of space can help people to be more comfortable in their environments, and it can be more productive for their well-being and their work. So even in an extreme example such as a mental health hospital, it can help. I've just written down a few highlights of this mental health hospital, such as the hallways being wider than usual to encourage people to communicate. There's a more welcoming feel, there's more lighting, there's more glass, so people feel more a part of the community. So I just thought that would be an interesting thing to think about to get started. Our physical environments where we live, for example, have a big impact on our mental well-being. There's an example of a town called Runcorn, which is actually in Merseyside, not Cheshire, where there were plans to demolish quite a lot of houses there. And as a result of this, there were a much greater number of GP appointments for anxiety and depression. And it's believed that the reason for this is because we see in our environment a sense of safety and security, and when it changes, or when it's in danger of being removed, we feel threatened. In contrast, when these plans to demolish the houses were overturned, the level of GP visits went back down, and that's seen as a sign that their physical environment did have an impact upon their mental well-being. Another example, as we can see in this photo, the street design of Cheshire is a very open plan, so anyone can basically drive down behind or in front of a house, and this doesn't lead very much to good mental health outcomes, as it leads to greater anxiety, it leads to people feeling less secure, and a reason for this is because they are suspicious of people that they don't know. They're worried that there might be a threat to their well-being from people who they don't know entering their neighbourhood, the street that they live on. So it's found that when some of the back streets were closed off, that the level of anxiety in these communities went down, and people communicated with each other more often, and that is also good for mental health. That communicating and having meaningful social connections reduces anxiety, depression, many other things as well, addiction. So yeah, it's found that if you live in an environment which doesn't force you into a situation where you're surrounded by a lot of people, and you can choose whether or not to interact with a lot of people, then in fact that makes people on the whole less anxious. Air quality also has a major impact upon our mental health. During the late 1950s, early 1960s, the level of suicide went down a lot, and there were a lot of theories as to why this was. Perhaps the lessening of symptoms from PTSD, which soldiers would suffer from being in wars, perhaps an improvement in the economy, perhaps a change in culture. But it was found that the main reason was the discovery of oil in the North Sea, which replaced coal to some extent, and that reduced carbon monoxide poisoning, which as a result reduced depression, which can result from carbon monoxide poisoning. So thinking about how we can change our working environments to help our own mental well-being as well as that of others. Simple things such as handwriting and the use of fonts which are readable, text which is big enough, and language which is simple enough can improve our mental well-being. From making notes to ourselves, which we can later understand, to reading instructions for putting together a piece of furniture, to GP prescription, posters, signage, all of that. When we understand it more, we feel less alienated and therefore less anxious. Something else to consider in terms of where we live is student accommodation. Most student accommodation is designed like this, with a corridor with rooms on either side, and it's found that this isn't a particularly good design for mental health, because when we step outside of a room, we're immediately in danger of meeting a large number of people, some of which we may not get along with, some of which may be a threat in some way. So this increases anxiety and leads to students feeling that they should avoid people, even outside of the accommodation. It was found that in things such as GP appointments, when they were living in accommodation which is this design, students would sit further away from each other, they would avoid eye contact, they wouldn't talk to each other. Whereas if there's a design of accommodation which doesn't force people to communicate but leaves it up to them to communicate, then perhaps counterintuitively they then communicate more because they feel more relaxed, they feel less anxious. So it is found that people who live in a accommodation style which I just described were in situations such as GP appointments and that sort of thing, that they would sit closer together, make eye contact, and communicate. So I think it's important to just think about where you live and when you're looking for accommodation to take these things into account. I've already touched on this, but in terms of writing and making things easier to read, that's an important factor for our learning environment. Personalization of things, of messages, helps a lot. The example here, which I've given, is a study in which a quite large number of people were invited to a group job interview, and only about 10% of them actually attended. This was through a general invitation which didn't include their name, the work coach's name, a good luck message, any reference to the actual recipient. Whereas when the invitation was personalised to include the recipient's name, the job coach's name, and a good luck message, a much greater proportion of people attended. So simply making people feel that they matter through personalisation makes people feel more valued, less anxious, more willing to get involved in activities and new experiences. The weather has an impact upon our mental health. I've included two contrasting case studies here. One on Inuits, in which it was found that changes to their environment, including from climate change and other causes, did in fact impact upon their mental well-being, their emotional state. Another study from the University of Cape Town found that extreme weather conditions such as heat waves and freezes, floods, hurricanes, did have a direct negative effect on the mental health of people there. For whatever reason, it was found that this was more the case amongst white people rather than black people. I'm not sure why that is. That's something to consider. But for our own working environments, in terms of the changes which we can make immediately to our working environment, it's important that we have some control over the temperature of the room, that we're not exposed to the elements, we're not exposed to the whims of the climate. So when we're choosing somewhere to work, we need to keep in mind if it's in the summer, whether there's good ventilation, perhaps if there's air conditioning, and during the winter, if it's got good heating, if it's got good insulation, and that will impact upon our mental health. It will make us feel more secure, less anxious. An area which has been studied quite extensively is social media. Social media's impacts upon our mental health. It's also a common feature of our working environment, especially in the modern day when we have phones and laptops and tablets which alert us immediately if we've received a message, and therefore challenge our concentration. It was found that social media can lead to increased risk of self-harm, depression, lower levels of self-esteem. And this was found to be more the case within females than males. However, it's still a problem for males as well. So what I would probably recommend is that whilst you're working, turn off the notifications on your phone, on any device which might notify you and distract you, and that will help you to work, and it will also probably keep you in a better state of mind whilst you're working. Okay, here are some more insights into work environments and changes which we can make to improve our working environments, to be more productive and to improve our mental health. Office design has been found to be very important, where there are quiet areas which we can go to be away from people. That helps. So if we're working, it can help for us to have the ability to work in a quieter place where we can concentrate more effectively. I understand that a lot of people enjoy working in noisy places, but if we have the option of working in a quieter place, that also helps too. And an important thing to think about is lighting. So if we have inadequate lighting, that can lead to headaches, eye strain, but also low mood, reducing from the gloominess of the environment, and a feeling of drowsiness. So it's important to have adequate lighting so that we can easily see everything within our working environment, and that has a bigger impact than we might think. So perhaps bringing a lamp closer to where we're working, or sitting closer to a light source can help. Although it's been found that natural light tends to be more effective than artificial light, even though artificial light is also beneficial over inadequate light. So if you can sit by a window which will provide you with plenty of light, that will be helpful. In contrast, if the light is too harsh, that can increase anxiety. So there's a balance that needs to be struck there. I think it's important to cover COVID-19 in the current situation, and how COVID-19 has impacted upon our working environments and our mental well-being, because a lot of people are working from home nowadays, and what that puts a lot of emphasis on is our internet connection. Because in today's day, our internet connection and the internet in general has a big impact on our mental well-being, our feeling of being connected, and this is very much exacerbated through COVID-19 and keeping us closer together. It's been found that loneliness and social isolation is greater in rural communities, and a lack of internet connection is a big part of this. So in terms of our working environment, we want to make sure we have a good internet connection. If we have a connection which is not reliable, then perhaps we should consider working somewhere like a library, for example, where there's good connection, if the libraries are open, that is. And this will help us to feel more connected, and in work it will help us to feel as if we have more direction, we know what we're doing, we have better communication with our colleagues and our supervisors, and this will in turn reduce anxiety. So I'm hoping that it was helpful in some way to think about how we can immediately change our environment, our working environment and our learning environment, to improve our productivity and our mental health. Things such as changing the lighting, to the temperature of the room, to where we choose to work. All of these things have an impact upon our mental well-being, and there's some things to consider in terms of town planning and where we choose to live, which are bigger decisions for our mental health. But I hope this has been helpful, and if you have any questions, you can contact Tianmei World Academy on LinkedIn, and we'll be happy to answer them.